So this feels very weird indeed, but I'm very sorry I can't be with you in Manchester today. When Tony asked me to do the lecture, I was very flattered, but there's no way that unfortunately I could travel to Manchester anymore. And what Tony then suggested was that we did it like this as a form of reasonable adjustment. So I hope it works for you. What we agreed I would talk about was looking back on improving life chances of disabled people, which was, for those of you who don't know, it was a 25-year strategy published by the Labour government in 2005. And I worked on that as a freelance consultant with a small group of civil servants who were based in the Prime Minister's Strategy Unit in the Cabinet Office. And as part of that, I organised for the group of us, the civil servants and I, to meet with a number of disability organisations and disabled people, which included coming up to Manchester to visit Breakthrough UK to see the employment support that they delivered. And Lorraine organised that visit. And so the civil servants who came up heard about how Breakthrough advisors, most of whom were disabled people themselves, helped to address a range of barriers, how they challenged employers' attitudes and assumptions, and how they acted as advocates for disabled people that they were working with. I'd been brought in to what became the Life Chances Strategy to work on independent living, which actually then became the main thrust of the whole strategy, mainly because I was able to introduce civil servants to the ideas, the organisations and the individuals who'd been working for so many years for our rights to choice and control in our lives. Tony told me that Lorraine saw the Life Chances report as a policy high point, and it was certainly well received at the time by the disability movement. It was a moment of hope. It was a moment when we thought that government had finally understood the nature of what our lived experiences were, the barriers that we face, and what the solutions might be, what would make a real difference. And although perhaps inevitably the policy proposals didn't actually go far enough, the general feeling was that, to coin a phrase, things could only get better. Little did we know. Life Chances was followed by the setting up of the Office for Disability Issues, which is still supposed to be, I think, a cross-government unit with the aim of promoting disability equality across all government departments. And also it was followed by the Independent Living Strategy, which I also worked on and which Lorraine also helped to influence. And that was published in 2008 and was a 5-year strategy. There were two particular commitments set out in Life Chances, which the disability movement especially welcomed. The first was one that said that by 2010, every local authority area should have a user-led organisation modelled on existing centres for independent living. And the second was a cross-government approach to providing disabled people with the resources, whether it was the money, the services, or adaptations and equipment, which would enable choice and control and social inclusion. And this was to be initially delivered by piloting individual budgets, which were to include not just social care funding, but also healthcare, continuing healthcare, employment support and disabled facilities grants, as well as independent living fund money. But of course what happened was that the Life Chances strategy was followed by the financial crisis in 2007-2008, which was less than 3 years after it was published. And we were only 2 years into the 5-year independent living strategy when the coalition government took over in 2010, and things changed. Like me, Lorraine at the time was struck by how quickly the public and the political discourse changed, and it separated disabled people into those who could be categorised as vulnerable, as we were called, and who was a scrounger. How quickly the government's emphasis seemed to be entirely on reducing the numbers of people on out-of-work disability benefits, and how the gains that we thought we'd made and the opportunities that we thought there were for further progress actually seemed to disappear almost overnight. But actually, looking back on the hope that had been associated with life chances, it's possible to see that there were other policy developments happening at the same time as we were writing that strategy before the financial crisis, which actually sowed the seeds of what's to come under the coalition and then the Conservative governments in the years since 2010. And it's also possible to see with hindsight that we should have been much more ambitious in our proposals concerning independent living. So to take the first point, other policy developments at the time, Life Chances did include a chapter on employment, but it was actually what was happening in other parts of government which had a much more profound impact on disabled people in the years since. The disability movement had framed employment as a civil rights issue during the 1980s and 1990s. It was an issue where we were arguing for the right to work, excuse me, and an end to employer discrimination and other barriers to employment. And although the employment chapter did refer to discrimination barriers, it also framed the problem as there being, to quote, little incentive or assistance for people to move off benefits and into work. It made assertions such as work being, quote, a component of good health, or work as a positive driver for good health, and emphasised the beneficial health effects of work, almost as if employment was actually a treatment for ill health. And Lorraine herself, in commenting on Life Chances, raised a concern that the proposals in the employment chapter seemed to conflate impairment and ill health, leading to a possibility that people who were ill, rather than just experiencing an impairment, would still be expected to work. What we didn't realise at the time, or didn't notice at the time, was that in the same year that Life Chances was published, the government also published a document called The Scientific and Conceptual Basis of Incapacity Benefits. This report had been commissioned by the DWP and was to form the basis for what became the Work Capability Assessment. That document argued that in order to reduce the numbers of people on out-of-work disability benefits, the social security system needed to bring about what they called a fundamental transformation in the way that sick and disabled people see themselves. This fundamental transformation involved separating disabled people out into two main categories: those who were considered to have, quote, severe medical conditions and permanent impairment, and those with what they called common health conditions. And it was this latter group that they thought made up 2/3 of people who were actually claiming out-of-work disability benefits. They argued that it was only the people with severe and permanent impairments who the welfare benefits system was supposed to provide for. The experience of people with common health conditions, they said their experiences were, quote, subjective, and it was therefore people's attitudes and motivations which were the main barrier to employment. So instead of seeing the lower rate of employment amongst disabled people as a civil rights issue, governments of all persuasions have presented the numbers of people eligible for out-of-work disability benefits as the problem. The focus is therefore on getting people off benefits instead of delivering equal opportunities for employment. The focus is on scrutinising whether people are fit for work, not on what changes to working conditions might make employment possible. The focus is on people's supposed attitudes and motivations, and not on whether suitable work is actually available for people in the local labour market. And worse than any of that is the denial of people's own experiences of illness or impairment. Unless you can be categorised by a measurement that's devised by the DWP as having a severe and permanent condition, then your experience is considered to be contentious. And the work capability assessment gives assessors the power to determine a person's level of impairment or their experience of ill health, treating as irrelevant not only medical diagnosis, but also how people themselves experience their impairment or illness and how it impacts on them. And alongside that, work is now framed not only as an obligation, but increasingly as a response to ill health, to such an extent that the 2017 White Paper on Work and Disability was jointly published with the Department of Health and the Department for Work and Pensions, and it urged healthcare professionals to, and I quote, see work as a health outcome. At the time of Life Chances, disabled people had welcomed the way that the government formally adopted the social model of disability, which is the first time a government had done that. But what we hadn't realised at the time was how the model would be misused. We had spent over 30 years emphasising that it was social, economic and attitudinal barriers and not impairment that held us back. But this meant that we were caught on the back foot when at the heart of reforms to welfare benefits was the denial of people's experiences not only of impairment, but particularly of illness. So it's not surprising, therefore, that it's often been people with chronic illness who've made the most vocal challenges to the work capability assessment and also to the replacement of disability living allowance with personal independence payments. So, for example, in 2012, the Spartacus report about welfare reform, which was written by a group of social media activists, many of whom couldn't even leave their homes because of chronic illness, hit the headlines, and it helped to bring about a series of defeats for the government when it was legislating to reform DLA. And since then, a movement has grown of people with chronic illness who seek to apply the social model to their experiences. And in so doing, they have enriched and developed our understanding of the social model. Life Chances would have been a much better strategy if these groups and their experiences had been involved in the disability movement in previous decades, and particularly if we'd consulted them in developing the Life Chances proposals on employment. It wasn't just that those of us working on Life Chances didn't pay enough attention to what was going on elsewhere in the policy jungle. We also made a fatal error, in retrospect, in our proposals on independent living. So yes, it was great that the Life Chances strategy adopted the disability movement's definition of independent living. And the commitment in Life Chances to pilot individual budgets laid the foundation for what became personal budgets for social care, with the intention, at least from our point of view, that self-determination would be achieved by giving people more control of the resources needed for their support. But personal budgets haven't delivered self-determination or independent living. Instead, in the context of significant cuts in funding for social care, the level of resources has too often been reduced to only providing the most basic personal care to people, to the extent that people are very often just being warehoused within their own homes. And most importantly, there remains a completely unequal relationship between disabled people and social services professionals, because it's local authorities who have the ability to determine through the assessment and the resource allocation process what kind of life we can lead. When we were developing our proposals for independent living in life chances, we didn't pay enough attention to the growing resistance within the DWP to the Independent Living Fund. The RLF had been perhaps the most successful independent living policy there's ever been in this country, but it happened entirely by accident, and DWP as a department was never reconciled as to why the budget should be their responsibility rather than that of social care. We should have recognised at the time of writing Life Chances that the ILF had more potential to deliver a right to independent living than any reform to local authority social care. The origins of the ILF were important. It was set up in 1988 to replace what was then called the Domestic Needs Allowance, which was a social security payment, part of the social security system, which covered the additional costs that those people who needed help with what was called ordinary domestic tasks. So it was part of a system based on entitlement. If you met a certain criteria, you had the right to a certain amount of money, and it was your business as to what you did with that money. And although this principle of entitlement was undermined by the gatekeeping role that local authorities had in accessing ILF money after 1993, when the ILF was reformed, there was plenty of evidence of the empowering role that the fund played before it was abolished by the coalition government. When we looked at the time of developing Life Chances at the problems with social care, in particular at the varying practice and policies across local authorities, the difficulties that disabled people had moving from one area to another, the obvious question arose as to whether independent living should be funded on a national basis and taken away from local authorities. And we did float this idea, but the response was that this would undermine the local accountability that was achieved, supposedly, by leaving it with local authorities. And instead of accepting this argument, we, but especially me, because of the particular role that I had, should have challenged it and put the case for an independent living system nationally funded and based on the principle of entitlement. We should have done this because the social care system does not, unlike the NHS, deliver support on the basis of need, but instead delivers it on the basis of the resources that are available. And while local authorities have the legal responsibility for social care, it's central government that determines what level of resources are available. So local authorities are given the responsibility through the Care Act to achieve all sorts of things, but they do not have the power to deliver it. Life Chances didn't tackle this fundamental problem. Neither did it address the impact of the privatisation of social care services, which had been steadily happening since the 1990 Community Care Act. By now, it's clear that the so-called market in social care services that had been created by that legislation has failed. Both home care and residential care providers are finding it increasingly difficult to make a profit because of the squeeze on the amount of money that local authorities will pay. And the associated low level of pay for care workers means that care providers have difficulty recruiting, and that situation is only going to get worse after Brexit. What's also happening is that having failed to make sufficient profit out of residential and nursing care and from some private hospitals, private capital is now increasingly moving into supported living for people with learning disabilities, which is likely to lead to developments which are very far from the original vision of what supported living was about. The self-determination that personal budgets were intended to deliver has mostly failed to materialise. Life Chances have pointed out that delivering independent living would require a cultural shift so that social care professionals are working to promote self-directed support. And while some people in social care try very hard to support people's self-determination, they can only struggle against what is an inherently disempowering relationship. 3/4 of people over the age of 65 are on local authority managed budgets, which aren't really personal budgets at all, because they have little or no choice of who provides their care. And even amongst people with physical impairments under the age of 65, the group who pioneered direct payments, only half receive their budget as a direct payment. And there's increasing evidence that local authorities are placing more and more restrictions on what direct payments can be used for. For example, by insisting, contrary to the Care Act guidance, that people have to use a prepayment card instead of having money paid into their bank account. We do have Article 19 of the UN Convention on the Rights of Persons with Disabilities, which sets out the equal rights of all persons with disabilities to live in the community with choices equal to others. What we have to recognise is that the current social care system is incapable of delivering this right. We need, therefore, a radical change, and if we're to have any chance of delivering our Article 19 rights. We need the kind of radical change that's set out in the proposals recently published by the Reclaiming Our Futures Alliance, which is an alliance of disability organisations in England. These proposals include a national independent living service funded from general taxation, free at the point of delivery, like the NHS, and delivered locally in co-production with disabled people. It's this kind of proposal which is necessary to deliver our Article 19 right to independent living. And one final and related point is that one of the things that Life Chances did get right was the proposal for a national network of disabled people-led organisations modelled on Centres for Independent Living. There was a project set up by the Department of Health and the Office for Disability Issues, a programme which was intended to deliver this commitment, but it was never fully realised. And since 2010, many local disability organisations have had their funding cut and finding it increasingly difficult to hold on to existing contracts to provide direct payment support services. But local organisations are a vital part of any nationally funded independent living service. This is because it's at a local level and amongst disabled people themselves that we'll develop innovative ways to enable people to live ordinary lives, because that's what's always happened. It's amongst ourselves and our organisations and our communities and our allies that we develop the innovative new ways to actually enable us to achieve independent living. And this actually relates to an issue which is of concern to the majority of the population, not just disabled people. It's the question of how to design and deliver services that are responsive to the wishes of individuals, that are accountable to their users, rather than to shareholders or to a professional group whose culture is one of "we know what's best for you." What we need from government is investment in the infrastructure which enables us to develop our own responses to making Article 19 a reality. And I know that's also what Lorraine would have considered a priority, because although she had a key influence at national level of policy making, it was in her own city that she helped build organisations which make a difference to disabled people's lives. Thank you.